Hi, everyone. We're going to take a second to introduce ourselves, as I realized we hadn't done that in our previous videos before we get started, but we're all first-year clinical psychology doctoral students at Adelphi University. My name is Travis.
My name is Neelam.
My name is Gavriel.
Yes. And now we're going to talk a little bit more about what these videos were intended to do.
Yeah, so this is a project we're doing for our individual differences course, which is a required course for our first-year doctoral students. And the theme of the project, as you might have deduced by now, is COVID and psychotherapy. And we selected this as the theme we wanted to explore because it just seemed like a really topical thing to do right now. And now that we're hitting the tail end of the pandemic, to sort of unpack a lot of the themes of psychotherapy and COVID and see what clinicians' struggles were with it, what they thought patients struggled with about it, and maybe what some of the positives were about it too. And as telehealth is becoming a more prevalent form of psychotherapy, to kind of, as we're entering the field, have a better understanding of what that will mean for us practicing in that medium and be able to go into it with a little more information than clinicians unfortunately had to go into it about 2 years ago. So this conversation is just going to be the three of us sort of unpacking some of the themes that we took from 3 of the interviews we did. As you can look at on the rest of our channel, we did an interview with Dr. Afshan Muhammad Ali, who is a more newly practicing clinician. We did an interview with a second-year student named Natalia, which is our most recent video. And she's a student still in the program, so she's on externship currently and had experience doing telehealth on her externship, some of which was with children specifically, which is a unique population. And we also did an interview with Dr. Bob Mendelsohn, who has been a practicing clinician for over 50 years and also had to pivot to telehealth during the pandemic. So these perspectives should hit really different ends of the clinician spectrum, and I think you'll see that from the interviews, because that they do offer pretty differing perspectives, which is really what we were aiming for in compiling those. So without further ado, we're just going to start sort of unpacking what we thought were the big takeaways that maybe you can look at in those videos.
Yeah, thank you for that introduction, Gab. What I really appreciated, you're right, that you tapped into was the really broad perspective we got from people at varying levels of experience. With, like you mentioned, Dr. Bob Mendelsohn having like 50 plus years of experience. Dr. Muhammad Ali just recently went into private practice, and Natalia is currently in training. One of the things that I noticed was this idea of parallel processing that they each spoke about, where you're experiencing the pandemic as a person going through it and simultaneously having to help your patients through that as well. That process it was interesting how that process looked for each person. It was also really humanizing on the therapist side to see what they were going through during that period. I didn't expect to come out of these videos having a more thorough understanding of that. I also didn't expect to have a more thorough understanding of what advocacy work looks like. I believe each of them tapped into this in a different way. One of the more concrete ways was when Natalia was mentioning potentially having to go to a school and trying to understand what the barriers were for her patient, especially with children. I think advocacy work comes in like really importantly, in addition to practicing in the clinic room or on Zoom, whatever it may be. I also did not expect the amount of positive outcomes for telehealth. It was much more than I anticipated it to be. One of the reasons being in the literature itself, there seems to be a bit of a negative skew in terms of the information and the disadvantages that it might pose while there are obviously upsides to being able to reach a broader population, and at different times and having more flexibility, there certainly were barriers that were presented. But I really appreciated the nuanced perspective that Dr. Muhammad Ali, Dr. Mendelsohn, and Natalia provided in that. And I think that was something that resonated across each of them at varying levels. Yeah, that was my take on these.
Yeah, I totally agree with you, Neelam. I think a big thing that was like highlighted for me is that a lot of the challenges that we're seeing that do exist, not just with telehealth, but with COVID in general, in terms of disparate access to healthcare, in terms of people being more affected by what's already there, is that none of these problems are like new problems. Like they didn't just kind of appear when COVID started. It's just not only bringing them more into light, because there is a lot of opportunity for reflection on these issues, and it made them more visible in some ways, but also just exacerbated the issues and the challenges that were already there. And in terms of like some of the advocacy work, I think what was really valuable in hearing, especially from Dr. Muhammad Ali and from Natalia, is how, addressing some of these barriers to mental health care, it's not necessarily just like a passive process or like an attitude, but more of a stance of being proactive. And they were talking about actively like reaching out to communities who don't have this kind of access, and connecting them with resources, or actually, so when they talked about parallel process, I thought of that not just in terms of parallel process in the sense that like clinicians and patients are experiencing the pandemic and the challenges associated with it at the same time, but that in parallel to like our work as clinicians and like the work that we're doing within the session, when we talk about, cultural humility and talking about advocacy work and talking about addressing some of the challenges within our field and within broader systems, that we also need to mirror that in our everyday lives and outside of the therapy, and going out and actively doing this kind of work. So that was something that really resonated with me, and I think is also, I'm going to carry with me as well.
Definitely.
Yeah, I think some of the things that got showcased were sort of double-edged swords, because you had situations where patients felt the therapy process was a little bit more humanized by telehealth, and there was that feeling that the therapist is going through a lot of the same things that you're going through as the patient. But for some patients who were not in the same position to be able to just stay home, they may have had essential jobs, they felt that their situation was very different from the therapist, or very different from most people's during the pandemic, and that telehealth relationship might have showcased that.
Yeah, that's interesting. Yeah, that was reminding me about what Dr. Muhammad Ali mentioned about disclosing more. She found herself disclosing a little bit more as part of the therapeutic process, because she was understandably going through similar concerns. And Dr. Mendelsohn mentioned this as well, but he himself was afraid to walk on the street, and now he's having to help his patients overcome that as well. And you're right, patients tapped into that. They mentioned it. And like being able to work through that together was important. It's also really interesting about navigating that on the other side. I think Dr. Mendelsohn mentioned a little bit about this, like how do you like reconcile like prejudice beliefs potentially as a therapist, like in the therapy room. He tapped into that on the other side of things. And I thought like seeing that contrast was really helpful to me, to know, what was happening as you're going through with your patient, having to disclose more, and the sort of like privilege you might have, like being able to quarantine. And Dr. Muhammad Ali mentioned that as well. Having the appropriate space to do that, and like how much you reconcile like um, problematic beliefs that might arise. And Natalia mentioned this as well about not assuming anyone's experiences. That it's really important to ask, because even if someone is essentially the same background as you, and if you've had extensive experience in it, there's just so much variability. And I think that was one of the biggest things that I took away from that also.
Yeah, that was a great example of something that was always sort of a tenet to psychotherapy, but that the pandemic really highlighted. So it was always not a good idea to assume someone's experience. But given this conversation we had with her, that it was really reinforced during her time as an extern, and it was a big takeaway for me as well, to just, you don't assume. And she had a good saying about it. I think it was something like, when a patient says, like, you know how it is, or it was something like that, and she goes, no, I don't know how it is, tell me what it is.
Yeah.
Even if she does know, right? It's to hear the patient's verbiage that might get you to be able to glean something of value.
Yeah, I think just like in terms of like practical tools for like therapy, I think just like doing that work in terms of like self-reflection, and then just checking yourself, like, am I coming from like a stance of like humility and just maintaining a stance of like curiosity? I think like if you can kind of stay in that space, then like you're kind of able to stay like on a good kind of track, no matter kind of like the circumstance.
Agree.
And I think one of the things that that came up about from our conversations is that I think the pandemic also highlighted, that by offering like a real kind of like slowing and bringing some of like these issues to light, to really like check in with ourselves, to continue that self-reflection. And I think that when we're talking about terms of positives and negatives, that could be something that's a positive, that I think it caused some people to really like stop and evaluate themselves. And when we're talking about going forward, that's not something that should end with COVID, that's something that we should be doing periodically, not just during these really massive changes.
Yeah. And that's something that was one of the really important points that I took away from Dr. Muhammad Ali's talk as well. She mentioned something like, which was ironic in my head until she said it and I thought about it. There's more agency to some extent that was brought to us by the pandemic, because it really stopped us. It forced us to stop and think about what we're doing, why we're doing it, and as she mentioned, how it's shaping us. Because she said that therapy is permanently a part of her practice now. Dr. Mendelsohn, it was always part of his practice. And for Natalia, it's been her norm. So yeah, I think I never thought of it about I never thought about the pandemic potentially like giving me more agency, but it really is forcing me to think about what's important, both personally and professionally. You're right, it's a continual process. That's something I'll continue to think about long after this.
Mm-hmm.
Yeah, there was something that came up, and I wanted to ask you guys, again, like as we think about it being a parallel process, about experiencing the stress of a pandemic on top of, the stresses of clinical work. Bob talked about how important like finding like means of coping, finding like support systems, like if you guys are like comfortable, and I'll share as well, like what do you think those could look like for us, like as we go forward, like just finding ways to find that support as well, and to take care of ourselves so we can take care of like our clients.
I know Bob always says and emphasizes the importance of being friends with other clinicians, and I do think that's important because it is an isolated profession on the day-to-day, and it's not like, yes, it's social in that you're sitting with someone and you're you're spending time around people, but it's not a normal social situation. It's not two-way. And so, you know, it is important to have other clinicians you can talk to and relate to about the difficulties of the work, especially during a time like a pandemic, when for most clinicians, they lost that support system.
Yeah.
That's the first thing that came to mind for me as well. Like I hear Dr. Melson's voice in my head echoing, like, be friends with your cohort. And it's not only our cohort, finding that support from them, but like Gav mentioned, like other clinicians, because it is such a unique experience. Even this whole process of training, it's hard to explain it to someone on the outside. And I think, and I know my strongest like support system will probably be within my peers, but also a handful of people that are very close to me. Outside of this, I think it's coming back to, when I think of support, I think of social support. But part of it is also like giving myself mental space to be able to process. I think prioritizing time to think, honestly, whether that looks like a walk, a night, or something like that, is really important. Whatever it is that we do for self-care needs to be like the top of priority to be able to support other people, and simultaneously having like strong social support, something that the pandemic kind of stripped away. Holding on to that.
I think it highlights the importance of self-care in a way that's extra special to this profession, because it's not like some jobs where you can show up exhausted one day and just wait, get through the day and wait till 5 o'clock. So you do kind of need to keep your mind in working order, whether that's making sure you sleep really well or exercise or eat well. I mean, every person has one or all of those that's a little more important to keeping their body and mind running well. And, apart from having the social dynamic that we talked about, having peer relationships, that I would say that comes to mind.
Yeah. I totally agree. I think those relationships are just extremely important. And I think also like in terms of like creating that space for your own kind of care, it also comes with that in terms of like setting boundaries as well, for your time and like for yourself too. And I think that's something that also came up with Natalia, because there's differences in terms of like how available we are, because like we are on telehealth, I think, and at one point like we need to be like having a degree of flexibility, which is really important, but also like setting enough so that we're not overextending ourselves and burning out in that kind of way.
Yeah, I do think it's individual. I think there are people who can't work all on telehealth, and maybe now there are going to be people who don't feel like, depending on their hour load, they can't work all in person too. And you have to be okay, even if maybe you have an extra patient hour, saying, I can't take another Zoom patient right now. It requires a different type of focus, and basically figuring out a system that works for you. But I don't think there should be a pressure to be willing to take an endless number of patients on whatever medium they prefer.
Yeah.
Because it is taxing in a different way.
Yeah. And Dr. Muhammad Ali mentioned that, like, figuring out what's distracting to you, making sure, like, really being conscientious about how you present in that virtual space, to be attentive to that person. There's a different set of cognitive load that goes into making that process happen, and having other people feel like you're present with them, for sure.
Like all these benefits in terms of like access, but there's a bunch of like, and information that like we talked about like seeing someone else's space, but with that also comes a host of like new kinds of challenges.
So I want to thank you for joining us. And I think the three of us would really echo that for us to take this on, that we're really grateful that we were able to take it on, and that there were these big psychotherapy takeaways of, you know, what it feels like to advocate, what the pros and cons of telehealth are, what the reminders of the importance of self-care, reminding of the importance of not assuming a patient's experience, that those are like huge takeaways for us, and that being able to like be in the room or in the Zoom for those interviews was really impactful. And so we hope you get some of that effect from it as well, and that you're able to glean something from the channel.
And thank you for watching.
Thanks so much.
Thanks.